This video sponsored by BuyMote shopping app. BuyMote e-shopping application is one of the online shopping app now available on Play Store and App Store.
Hi guys, if you are in nursing competitive exam preparation, then you can join with me for practicing previous year MCQs.
First question, glucocorticoids and mineralocorticoids are secreted by options are option A gonads, option B adrenal gland, option C pancreas, option D anterior pituitary. In this question, correct answer is option B adrenal gland. Outer layer of the adrenal gland called adrenal cortex. It has three layers like zona glomerulosa, zona fasciculata, zona reticularis. Zona glomerulosa, it secretes mineralocorticoids. Zona fasciculata, it secretes glucocorticoids. Zona reticularis, it secretes both androgen and estrogen. Inner layer of adrenal gland called medulla, which secrete epinephrine, norepinephrine and dopamine. Second question, the most important hormone secreted by the pineal gland is options are option A parathormone, option B melatonin, option C thyroxine, option D androgen. In this question, correct answer is option B melatonin. Pineal gland is smallest gland in our human body. It is situated under the brain and above the hypothalamus behind the third ventricle. It secretes melatonin hormone which influences circadian rhythm and promotes sleepiness. Third question is main clinical features of hyperthyroidism. Options are option A diaphoresis, option B dry brittle hair, option C menorrhagia, option D cold sensitivity. This question, correct answer is option A diaphoresis. In hyperthyroidism condition, hormone T3 and T4 level will be increasing, TSH level will be decreasing. Clinical features of hyperthyroidism are goiter, exophthalmos, heat intolerance, diaphoresis, overeating, palpitation, tachycardia, hypertension, weight loss, tremors in hands. Other options are dry brittle hair, menorrhagia, cold sensitivity are clinical features of hypothyroidism.
Question is, which of the following condition is the most common form of hyperthyroidism? Options are option A Addison disease, option B Cushing syndrome, option C Graves disease, option D Hashimoto's disease. This question, correct answer is option C Graves disease. Graves disease is a type of hyperthyroidism caused by an autoimmune destruction of thyroid. Graves disease is a most common form and cause of hyperthyroidism. Option A Addison disease. It is a adrenal gland disorder. In this condition, inadequate cortisol hormones are there. Option B Cushing syndrome. In Cushing syndrome, in excessive cortisol hormone seen. Option D Hashimoto's disease. It is an autoimmune illness in which there is inflammation and destruction of thyroid gland. It is resulting in hypothyroidism. The question is, when a patient receives profile thiouracil, which following need to be promptly reported? Options are option A constipation, option B dysmenorrhea, option C sore throat, option D urinary frequency. This question, correct answer is option C sore throat. Profile thiouracil is an antithyroid drug used to treat hyperthyroidism. It can cause liver injury mainly in children and suppress WBC production by bone marrow. So advise the patient to report if they are having symptom of fever and sore throat because it indicate infection.